good. I haven't heard much about the nursing program. Um, uh, so I really can't say, but yeah, it is kind of a surprise to see that what we think of Pokey Little Toro is actually being known as a good place. Yeah, yeah, yeah. Um, it is interesting, and I think part of it is that so many of the press. Well, look, I'll be frank with you. Toro pays a third of what CUNY pays. There's professors. The benefits are very good. The pay is quite frankly lousy. I don't care because I have money from elsewhere. I don't, I'm doing this because I enjoyed it at this point. Um, but that means that you either get really lousy professors or you get really dedicated professors. And most of the people I've known here are pretty dedicated, and I think it shows. Um, Also, when you go to PA school or when you go to graduate school, it's very important to get a mentor, either at your placements or in the school or somebody from your undergraduate program. Because most of us, well, for example, I've been the outside reader for people's dissertations who went to Toro, and most of us still have contacts in terms of getting jobs and of giving you some ideas to where you can work and where you should stay away from. So it's very important to get yourself a mentor. Everybody has a mentor. I mean, I had mentors. Everybody has a mentor. When in yeshiva, my mentor was Rabbi Newberger and uh, to a certain extent, Rav Kolevsky. And in graduate school, I had other mentors, and you never get anywhere without that. I have no idea what happened to the rest of your. Maybe they're busy hanging up their stockings. Um, okay, so I'll tell you guys. Okay, we got 100% on the teacher evaluations. Hooray! Which means that you guys, since you're the only ones here, get to choose which question from the final you want to drop. So what I would suggest, if you have a group chat, that you all get together and decide which question you want dropped, and just let me know. We'll drop it. If you do not live in the New York area and it's hard for you to get to the final, to be in touch with Dr. Sofer, who will make arrangements for you. And if you are, I have let them know, and I will put it on the paper for the proctor that you're allowed to bring in your notes. Don't bring in completely written essays, but you can bring in your outlines. So it is, for your final. I have no idea how they're going to get them to me, but of course, the moment they get to me, I will grade them and I will have them up on the. Uh, uh, I will send you an email and I will pass them on to the registrar. So if you're if you need the grade right away for a graduate program, I'll get that in as soon as possible.
Thank you.
You're welcome. And if you are applying and you get interviews and you like, I will be happy to call your interviewer or the admissions director for your program. And I'm very subtle with it. I call them up and I say, hi, I'm calling about so and so. I know where you live. I know where your kids go to school. And usually, yeah, but we do what we can. You're welcome. Well, thank you. And remember, when you do a good job, you do a Kiddush Hashem. And if I've helped you to that means that I get some of that schar, and I can use whatever I can get. Uh, Great.
So I think I'm going to see you again next semester at the same time.
Oh, what are you going to be taking?
Advanced topics in psychology.
Oh, that's cool. I'm thinking about, in the past I had done it on personality disorders, but the new DSM is kind of weird. And I think that I'm going to pick up on um, the most recent developments in clinical psychology. There's been a lot of ferment in the field the last 5-10 years, and most of the stuff that you learn as an undergraduate has almost nothing to do with where the field is today. Today the field in one area is cognitive behavioral therapy, which is very big. Interpersonal therapy. Uh, um, it's called basically eclectic psychotherapy. What's the new term for it now? um, integrative therapy and psychotherapy, and then there's various things like EMDR and uh,
Somatic therapy.
pardon?
Somatic therapy.
Somatic therapies and Marshall Linehan's work with borderlines, and then the big thing now, which I think is kind of it's a fad, is Bessel van der Kolk's trauma therapy, where he writes about how the body has its own mind, something like. And I know I've met him. We aren't friends or anything. I know him, and I think he has a point about trauma, but it's become like an industry, and now everything that anyone has is a result of trauma. And while that's very Freudian, I don't think it's necessarily true. So we'll talk about that too. So that's what I have in mind. I plan to write the syllabus over winter break and see what I come up with. Um, and Also, sometimes you get tired of teaching about personality disorders. You get enough that when you graduate.
Professor, how
Okay,
much does it matter where you graduate from?
in terms of your doctoral degree,
Yeah.
as long as it's APA approved, it doesn't matter at all. No one has ever asked me, after my first job, nobody ever asked me where I graduated and where I did my internship.
hmm Because
People get, yeah, LIU?
LIU Post has a reputation of being extremely friendly to From Yedden.
Yes, it is.
So should that be my top option?
They're all pretty, look, tour, my experience with Adelphi is out of date. They've changed a lot. Um, okay, I'm going to be very cynical. Go where you get in, and if you get into more than one place, go where they give you the most money.
Uh, got
Okay.
it.
Yeah. Um, every program in order to be AP approved is basically they're all very, very similar. But you don't want to go to a program that's not APA approved. You won't get a decent internship and it'll be hard to get licensed.
hmm
So like Seton Hall, last I looked was not APA approved. So I wouldn't suggest somebody goes there. Pain in the neck. And also most jobs for psychologists are in the VA system, and they will only take somebody who went to an APA approved internship. Um,
I only applied to APA approved programs, but I saw that there is a movement of some schools to not be APA approved. Like Stony Brook recently um, changed their curriculum and stopped getting APA approval, and they're considered, I think, a good program.
yeah, they are a good program, but it's going to be really hard to get an internship and really hard to get a job. I don't know why they did that.
Right.
Um, and as I said, the VA requires you to go to an APA approved program, and that's where if you're working in an institution, they pay pretty well, and their internships pay pretty well.
hmm
As far as internships go, so I don't know why they did that. I had some dealings with the school a long time ago, and they weren't particularly friendly to my firm students. But again, most of the people I had dealt with have already retired, so I don't know what it's like now. But you know, you're putting out a lot of money and a lot of time. Why go to school where you're gonna, which is a bit of it at best?
Right. No, that's why I only applied to APA approved.
Yeah, yeah. Um, the there there are good jobs in psychology. Obviously, there are good jobs for PAs, and as my son keeps reminding me, he's a physician. He goes home when he's done with the patient. The PAs go home at 6 o'clock. You know, it's a real lifestyle difference. And I see now that there's a lot of PAs around here that are basically the medical directors for urgent care centers. Um, they have to work under physician's license, uh, and for routine visits, they're fine. When there's something complicated, they have to have enough sense to refer to a hospital or an ER. But they obviously these people make a very nice living. In terms of psychologists, as I mentioned here in Clifton, social workers are making $300 an hour in private practice. So obviously you can charge more. Um, And here in Lakewood, I don't think there even is a firm psychologist. I think they have just social workers.
There
Um,
there are a few, but I think I live in Lawrence,
mhm.
but there's a famous Lakewood psychologist who runs a whole clinic now, so it could be under him.
Wait,
He's
what
just
clinic is that? Um,
I don't know what it's called. He's famous not like in the world, meaning for from
what's it,
psychologist.
what's his name?
Forgot, trying to remember.
He's not that famous.
Right.
Uh,
At least his name's not memorable.
yeah. Um, yeah. Yes. Yeah. 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 My daughter was told in Alaska they do not have any pediatric neurologists in the entire state. And so they offered her a job as a locum tenens. And she said, I am not moving to Alaska. They said, no, no, no. We fly you in once a week. We put you up in a hotel. You see patients, then we fly you back home. And for that, they're paying a huge amount of money. Yeah. Yeah. So she doesn't want to go to Alaska. Um, yeah, I'd go in a minute. They don't do that, have that for psychologists though. The other thing which is cool, yeah, there's an Orthodox community up there. They even have a mikveh. This guy years ago in the 1980s, this guy won the World Series of Poker. He's a frum guy, lived in Alaska. His family were fur traders, and he basically built a mikveh out with his winnings from the World Series of Poker. It's pretty cool.
That's crazy.
Yeah, but yes, uh there is an Orthodox community there. Not a big one, obviously, but there is one. Um, the we're I think it's basically in Nome, but I'm not sure. Okay, guys, so it's just us. So I'll just talk to you briefly about autism, and again, you guys will decide what question you don't want. If you have any questions about the questions, you know where to find me. Um, and if you can't make it for whatever reason to the in-person final, speak with Dr. Sofer. Um, the So autism was now it's very interesting. The way that the history goes is that in America, Dr. Connor was the first person to discover autism and name it. And the first patient, which I gave you the videos about, Donald Tipton, was fascinating. He was the first person to be diagnosed with autism. That's the story. That's the myth. The reality is that Connor did a lot of work in Germany with Asperger before the war. And Asperger, as you know, was the one who came up with Asperger's syndrome, which is a form of autism. It's no longer considered its own diagnosis, it's just considered to be high functioning autistic people. So it wasn't that Connor was amazed by this, he'd seen this before. Um, as was mentioned in one video, Asperger has a very mixed past. He was involved in the selection of children to go to gas chambers in Auschwitz. Um, and I don't know if he knew they were going to gas chambers, but he did separate out kids who he thought could be educated and kids who could not. And obviously, the ones who weren't educatable were sent to the gas chambers. But what they described was a cluster of symptoms. And, and again, they're on a spectrum from people who are very high functioning, and many of them are actually in a unit in the Israeli army. They have a unit of autistic people, and their work is in pattern recognition, which they're really good at. It's very, very cool. Now, like they'll show them pictures of a piece of land, and they say, okay, there's an airbase here, there's a hidden gun battery here, there's a this there, because they can do that. They're really good at picking this out, and it's really great for the autistic kids because they're serving in the army, and in Israel, that's a really big deal. And they feel useful, which they are, and they feel part of. Uh, they get a lot of covet, um, and I think it's a wonderful thing. The other thing, parenthetically, they have in Israel, this is great. In Bnei Brak, there was a lot of pushback against psychology and psychiatry, and nobody wanted to go to a clinic. Even the very sick people didn't want to go to a clinic, so they decided they would open a kollel. And the guys who need psychiatric care come to the kollel. They have a morning seder and a little bit of shear, and they take their meds, and they get their therapy, and like everybody else in Bnei Brak there in kollel. and they have the status of a co-mon. I think it's, and they get a stipend. I think it's a wonderful thing. Um, yeah, and yes, yes, it's very different than here, where they get crummy medical care at the VA, and they get and they're not treated well at all. Um, so yeah, so it's really pretty remarkable. So the autistic patient, one of the terms now they use is neurodivergent, um, meaning that they don't think the same way other people do. They don't experience the same way as other people do, and this is neurologically based. They're not psychotic, they're not schizophrenic. Uh, when I was first starting in this field, it was called childhood schizophrenia. Yeah, diagnosis of autism was not well known, and they were basically institutionalized from a very young age, and that's where they lived and died in an institution. And
Professor,
frankly, yeah,
is Ezra in the waiting room?
no,
Oh, he messaged before. He just messaged now. Is the meeting working?
nope. Let me put on chat to see just in case. Nope, not in the waiting room.
Hmm.
Maybe clicked on the wrong link. I don't know. Um, I don't know. I'm a psychologist. I'm not a computer dude. Uh, um, I had to learn more about computers than I ever wanted to know. So, um, but there are certain kinds of symptoms that we're aware of. People often will have trouble looking at faces. People have trouble. We talked about last time in terms of the mirror neurons. They have trouble reading expressions. They don't really understand people's expressions. They don't understand emotions, and they don't know what's socially appropriate because we give off social cues which are unconscious as to what's appropriate and what's not, but they don't get them. They can't read those cues. That's why a lot of them love emails with emojis because that tells them what people are feeling. But in conversation, they can't pick that up. And as a result, they say things or do things which are socially inappropriate. Not because they're bad, not because they're stupid, not because, but they don't. It's like they don't speak the language, or they live in a totally different culture. Um, the children who are very, very autistic are very, very damaged. They usually don't have language. They may even bite off their fingers or slam their heads against the wall. And those poor children are going to have to be in an institution for the rest of their life. But other children do reasonably well with ABA therapy. And I know at Toro they are now offering, I think they have a master's in ABA therapy. Uh, and while it looks very, it's a very rigid form of behavioral therapy, not cognitive behavioral, just basic behavioral therapy with rewards and punishments. Um, and some of that was started by Bruno Bettelheim, who had a special school for these children. Here is Ezra. And Bettelheim was criticized for basically being what people perceive as cruel to these children. I'm not taking a stance on that because I just don't know how to take a stance. Um, welcome, Ezra.
Hey, sorry I'm late. I don't know what was technical difficulties. I restarted it and it worked. So
Hey, I'm just glad to see you here. Let me give you the information I gave the other gentleman. You guys have all of you have completed the student evaluation, etc., with the result that I want you guys to get together and decide which of the questions for the final I should drop, which I will then do. And then you'll have a pool of 5. 3 will be on the test. If you cannot make it to the test, please let her know. If you need any kind of accommodations, let her know. And if you have any questions about the questions for the test, you can either ask them now or you can send me an email. So, Ezra, do you have any questions about the questions for the test?
No, but I was told to let you know that Adam is not going to be able to join this meeting, and I'm not sure if everyone else told you, but I told him I would say something, so I said,
Thank you. I appreciate that. Thank you. Please give him my regards. The So we're talking about autism, and you saw the video about the videos about the first person with autism, which I found fascinating. I also found it fascinating to see how people responded to him. Um, I don't recall if they said in the interviews, but in their article they mentioned that when they came to town to interview people about him, people took him aside and said, "Look, if you hurt him, we will find you." Which the entire town took him under their wing, which is really I mean it's quite heartwarming actually. Uh, he didn't speak till late. He obviously, you see him, he's kind of odd, but he worked in the bank and plays golf with his friends and has a kind of limited social repertoire, but people appreciate him. He had learned, and you see this with people on the spectrum, that there's certain appropriate responses to make. So every time he plays golf with someone, the person hits the ball, no matter how they hit it, he says, "Good shot." Uh, um, my daughter was working. One of my daughters was working with someone who she couldn't understand this guy. He would come to every meeting with a list of file cards with responses to questions people were going to ask him. And I said, he's probably a high functioning autistic person who isn't sure how to socially respond to things. And so his therapist wrote down responses for him to choose from. And yet he was very good at his job. As long as he didn't have to interface with too many people, he was doing fine. When he was in a large meeting, there were a lot of people he didn't do so well, and he had to leave the meeting. But otherwise, he did fine. Um, he was actually very sweet. Um, every holiday, he sent presents for my kids, my grandkids. He knew that my daughter had children, and he has obviously no children, and he's not married, and he just likes children, so he sends them presents. Um, so we're looking at people. Many of the people with autism don't make eye contact. Again, that's because making eye contact is a form of social communication, and they don't have it. Some of them do a lot of repetitive actions or repetitive. They have repetitive things they talk about, uh, and they can become experts on strange and arcane things. They used to call these splinter talents. Uh, there was Oliver Sacks writes about this a lot. He wrote a lot about autism. There's a boy, for example, in England who was an expert on the train system. He could tell you what trains were leaving from where to get to where, what connection, everything about it. But he didn't know what a train was. But he knew how the schedules worked. So a lot of them have these interesting talents. Um, you all read probably an intro about Blind Tom, who was a pianist who could play any piece for me, he would play it right back. Um, they have these are called splinter. They were called splinter talents. Now they just call them divergent abilities, which is much nicer than splinter talents. Um, One of the as I said, they have trouble with social interactions. Some of them who are higher on the level can have social interactions. Others are kind of like in their own worlds. Did you guys ever watch Sesame Street? Think about Bert without Ernie. Okay, what does Bert have? He has his bottle cap collection, and his pigeon, and that and Ernie are the only things he relates to. He's not a bad guy, but that's what he relates to. And so we see this with these patients. Sometimes we'll get fixated on one thing, like one of my patients was fixated on button for some reason. And every time I spoke, she would ask me about the button and where's the red button and where's the little red button. And after all, she gave that up and started fixating on something else. Obviously, she wasn't very high functioning, but she could talk and she could take direction. When you're working with the very sick ones or the moderately damaged ones, you have to have very, very, very low expectations and be aware that it's going to take a long time to make a change. So my poor patient didn't bathe, and didn't brush her teeth, and would stand toe to toe with you and tell you about her interest, which was her bowel movements. And she lives in Borough Park, and in those days there was a store, G and Sons, by the hospital. And these Hasidic women, I have no idea why they did this. At the time, I thought it was insane. They would leave their babies in the carriages outside and go shopping, and the baby would be in the carriage outside. And my patient loved to hold babies, and she would go to G and Sons and pick the baby out of the carriage and hold it for a while, and then put it back. I kept hoping she never mixed up the babies. I wasn't sure who was crazier, her or the mothers. I think the mothers were crazier. Um, can you imagine? I mean, would you leave your pocketbook outside? I mean, it's insane. So I had to work with her, standing 2 inches from my face with her rotting teeth and not bathing and talking to me about feces. So my first goal was to get her to brush her teeth. And my second goal was to get her to bathe. And my third goal was to get her to talk about something else. And the way I did it, because she didn't see anything wrong with her behavior, was to tell her that everybody else is crazy. You know, Marjorie, and people, a lot of people here are kind of nuts. And I don't know why, but they don't like talking to you unless you brush your teeth. I don't know why they like that, but they just like that. And, if you want to talk to people, I want to brush your teeth every day. Okay, so this took a couple of months, but she started brushing her teeth. And then I said to her, people are funny, Marjorie. I don't know what, but they don't like it when you wear the same clothes and never wash them and never take a shower. I don't know why. But maybe if you want, to talk to people or to be around people other than me, maybe you might consider like washing your clothes and taking a shower. This went on for a while. And finally I got her taking a shower. And always under the rubric of people are funny and there's a lot of crazy people in what I know like that. And then finally I said to her, I don't know why, but for some reason people don't like to talk. They like to talk about things other than bowel movements. I don't know. So I got her to read Reader's Digest. And so her conversation from that point on consisted of this article, this article, this article, this article, which, was kind of boring, but beat the heck out of finding out about her feces, which of course is what she wears, what she puts in her shoesies. She puts her feces in her shoes. No, it was, but it took over a year to get her to brush her teeth and to take a shower and read it. And the sad thing was that this could have been done years ago. This woman was in her 30s, but people basically put her on the pay me no mind list and just let her, kind of rot. Yes, and it's horrible. Yeah, yeah, yeah. Yeah, but also the other thing is that a lot of therapists are told these people can't be helped, and they just give up on them. Yes, yes. Yeah, I was seeing a doctor who basically, it was clear to me he was just going through the motions. He had no sense that there was anything that could be done about my heart. It's kind of like, yeah, he's going to go through the motions until I die. And I said, there's better doctors out there. What do they mean when they tell you don't buy green bananas? No, I'm teasing. I'm teasing.
So going back to
Don't buy green
uh,
bananas because you're going to die. That's so going back
going
to,
back to neuro divergent skills or divergent talents, what do you call it?
yes. Yeah, they
Um,
call it a lot of different things. I still, the word that I learned was splinter skills, but they don't use it anymore because it is pejorative. Divergent talents, they call it.
so it seems like at least what you hear is that they're often connected to music.
Um, those are the ones you hear about a lot. You hear about Blind Tom, you hear about other musicians. Uh, I'm not, I actually have a book that I was going to read about that. I didn't get to it yet. by Levitan about music in the mind, and also Anthony Storr wrote a very good book about this, and there are three major books on music and in the mind: Storr, Levitan, and hang on, let's see if it's on this bookshelf.
Is it connected to their
Levitan is a brain scientist. Storr is an analyst, and the third one, I don't recall it. It's not on this bookshelf. It'll come up in my wife says I had too many books. Be not after the making of many books, says Ecclesiastes. Koheles. That's a storm harbe.
Hmm.
There's a lot of work on music in the brain. Oh, music in the brain and ecstasy was the third one. I forget the author. There is a lot of work on this. I'm not aware of anybody specifically focusing on autism, but I could be wrong.
I wonder if it has to do with their affinity for patterns.
Could be. I mean, it's very possible. I think that's why a lot of them are good at math, and it's entirely possible. I just don't know. Let me shoot an email to my daughter and ask her. She works much more obviously in this area than I do. It's nice to have a tame neurologist on your own. I think we'll see what she says. I don't know. Oliver Sacks has written a lot about this. I don't think he's written about this in terms of music, although he did come out with a new book called Musicophilia, which I have not read. I don't know. Most of the work now, both my daughter and son have written chapters and books on autism. And one of the big, you guys know about the big controversy of vaccines and autism. You know that article was retracted and that it's a lot of nonsense and the guy lost his license to practice medicine. Okay. So I don't have to argue that with you guys, right? The
No,
reason why,
Professor, there's only one reason he lost his license. Because they
pardon?
had to shut him down so no one would listen to him.
Yes. Well, that's also true. But when you looked at his research, it was so fraudulent. Uh, Basically, he took a very biased sample, many of whom were his patients. He was funded by a group which wanted to disprove the use of vaccines, and the whole thing it was totally unethical. And they uh, uh, they filed a disclaimer that his article was false, and he lost his license and ability to do research. Which, considering he never really actually did research, but it became kind of a cause célèbre. And the reason why children begin to show signs of autism when they are vaccinated is that they both happen at the same time. We vaccinate kids with MMR and so on at a certain point in their life, and that's when they start to show symptoms. Although I saw, is it here? Hang on. No. I saw an article about a blood test that you can do with very small children, uh, which is indicative. Well, the ones here is about Alzheimer's, a blood test for Alzheimer's. But I saw somewhere there was an article about that with autism as well. I just don't recall where I saw it. Um, but at this point, nobody knows what causes autism. The original thought was it was caused by a refrigerator mother, a rejecting mother, and that's why the child was like this. And that was Bettelheim's theory, and that caused untold pain to numerous mothers. The deal is like this: when there's an autistic baby, and you hold them, they're not like regular babies. Regular babies, you hold them and they conform to the shape of your body, kind of bend themselves to be close to you. Autistic children, although they want to be held, are find it very unpleasant, and they will pull away. So the theory was, which is wrong, is that the mother was giving off vibes that she didn't want the child, and the child was pulling away from what was seen as an aggressive and hateful mother. It's totally wrong. They pull away because they are afraid to being held. That's why Temple Grandin, the famous autistic animal researcher, built herself a cradle, is a word, that she would lie down and then it would close in on her and hold her. She wanted to be held, but she was afraid or terrified of human beings holding her. She obviously was a very creative person, is a creative person. To this day, nobody knows what causes it. To this day, we see it as a spectrum disorder ranging from people who used to be called Asperger's to people who are now being called high functioning autistic to people who are really totally unfunctional, don't speak, may bite off their fingers, may bang their heads against the wall. There's no way to reach them. And unfortunately, this has led to a lot of scams for these poor parents. Remember, parents, as you saw with the video, this Donald Trippett's mother, basically, she sacrificed her life for this kid. And many of the mothers do. They really put everything on hold to take care of this child. But I totally lost my train of thought here. Okay, so anyhow, oh yes. So these people who have a child like this are kind of desperate for some kind of communications with them. And so there was a scam in Australia called assisted communication. And it worked like this. They would hold the facilitator would hold the child's hand over a keyboard and the child would type out messages. Mom, I love you. And these nonverbal kids would be typing out these messages. How they knew how to spell beats the heck out of me. Hang on. Here's my response. Well, and people were making a lot of money at this, and most of the people who were facilitators were honest and desperate to help and caring people. And it went to court because someone was suing, saying this is, I'm paying all this money, and the kid only responds to this facilitator. So they did an experiment in court. They had the facilitator blocked from seeing what the child was seeing. And they held an orange and they said to the child, "What am I showing you?" And the facilitator, if it really worked, would be typing "I see an orange." But they couldn't type anything. It turns out that with the best of intentions, they were misinterpreting these micro movements that everyone makes and interpreting this that the kid was actually spelling out a message, but the kid wasn't doing anything. But people spent a lot of time, money, and effort on this because they were desperate to communicate with a child. Okay, let's see. Okay, the word tells me there are some people with autism whose savantism, and the savant means these abilities, include perfect pitch, and some people with autism who have very little spoken language but can sing and communicate with songs. She doesn't know anything else specific, but this is not her specialty. So we can do some research, or you can do some research and report back to us next week. I mean, everyone knows about Blind Tom, and everybody knows about some of these other savants or savants, but I don't know the research. Yeah. Okay. She recommends a book, which I also recommend, called Born on a Blue Day by Daniel Temmet. Daniel Temmet has autism, and he also has synesthesia. So for him, like Tuesdays are blue, Wednesdays are gray, different sounds have different colors. And this guy can pick up any language in a very, very short amount of time. And he also apparently has perfect pitch. Devora tells me she's had a few autistic patients who are very talented musically in the sense they can play pieces perfectly and sometimes in an advanced way for their age, but none of them have ever have been creative or able to make their own compositions. So that's what we call a clinical report. It's not a study, but it's just, oh, I saw this and this is what it looks like. I'm not aware of any studies.
It's interesting that they lack the creativity. It
Yes.
fits the profile, kind of.
Kind of, yeah. The other thing is though, do you know much about music?
Yeah,
Okay, so you know what a hook is?
yeah.
A hook is like a little piece of music, like a turn is a piece of music. Did I tell you about this about the guy at the time, Beethoven, who wrote a library of hooks? Now, well, at the time of Beethoven, this guy made a library of these little pieces of music that were with very typical little snippets that you hear in classical music. And his theory was you could put them together in any kind of order and come up with a musical piece, kind of like AI before AI. And it was used. It was used quite a bit. Nowadays, there are two guys in, I think, Sweden who write most of the pop music that you hear. And they have on their computer a library of hooks. And they put them together. I don't imagine it's random, but they put them together and they come up with a song. And then they ask, say, Beyonce or Rihanna or Taylor Smith, maybe, I don't know if she writes her own stuff, but they ask them to come in, listen to the song, and say, do you have any changes you'd like to make? And then when the song comes out on the record, it lists Rihanna or whoever is composer, but really it's just a bunch of these hooks put together. So one would think if you can do that with music, the odds are at some point remember Dvorak only works with kids. At some point an adult might be able to do that as well, since it's basically mathematical. Um, you ever listen to a piece of music and say to yourself, I know exactly where this is going to go, or there's two ways it could go, either high or low, and yeah. So I imagine somebody who's autistic can do that too.
And my nephew's very high functioning, I guess, neurodivergent, and he's 7. He has perfect pitch, plays piano, and he listens to classical music.
Cool.
Just
Well,
strange for a 7-year-old to listen to classical music, or atypical.
I don't know. I did. I don't know. My dad, before he became a physician, was a professional musician. And so we always had classical and jazz music in the house. But yeah, yeah. My mother tells me that when I was a baby in the crib, I danced Verdi and to various operas and so. But yeah, the many nobody knows why they have these skills. Music is a very basic skill. Is it the appreciation of music is well, rhythm, for example. When you were a fetus, I realize it's hard to think back that far. And your mother walked, you moved back and forth in the placenta. That's 4/4 time. 1, 2, 3, 4. Back and forth. So that's why kids love swings and kids love to be rocked. And even as adults, we like rhythm. And it's not a far move from rhythm to melody. Um, who knows? In any case, so when one has a patient who is autistic, you have to decide where on the scale they are, and how trainable they are. And again, the treatment of choice right now appears to be ABA. That will probably change by the time you're my age. And uh, and the ones who are higher functioning can lead relatively normal lives. They can get married, they can have children. Sachs writes about a family of autistic people. The parents are both autistic, and the 3 kids are all autistic. And what they do after supper is they all jump on the trampoline at the same time, screaming, and the family loves it. That's their family activity. But obviously, they were able to function well enough to get married and have kids and hold jobs. Um, the There are theories that the person that Sherlock Holmes was after was high functioning autistic. And you can see it. He seems to lack human empathy. He doesn't really understand people's emotions.
Who
I
did you
think
say?
Holmes. Holmes was modeled after a Scottish physician who was Arthur Conan Doyle's instructor, who actually did a lot of things that Holmes does. He would look at your hands and tell you your profession, things like that. And apparently he also had trouble relating to people. And you see with Holmes also, he can't relate to people emotionally. It's interesting to think about in that sense. I don't really have much more to say about this. Do you guys have anything to say? Um, well, let's make it by the end of the week so you have time to prepare for the test. Yes, we do. Yep. So come in with your hangover, and yes, we will have class. Yes, yes. We'll wear a funny little hat and blow a whistle or something. Um, yeah, not this hat, a different one. Okay. I have nothing more to say. You guys have nothing more to say, so let us say good night.
I actually had one question.
Okay, go
Nothing to
for
do
it.
with the class. I just read this morning, it was talking about um, mortality in the US, and it said that death rates from a bunch of different things have gone down. One of them was Alzheimer's. What does it mean to die from Alzheimer's?
Well, usually people with Alzheimer's don't die from Alzheimer's per se. They usually die from opportunistic infections. When people are in the end stages of Alzheimer's, they're often